The most common cause of elbow pain is an inflammation of the tendons that attach here, in this piece of bone called lateral epicondyle, and this is called lateral epicondylitis. A common cause of lateral epicondylitis is repetitive movements of the wrist, like when a person has a poor stroke technique to play tennis. This is why lateral epicondylitis is known as tennis elbow. Other causes of lateral epicondylitis are repetitive movements in certain occupations like screw driving, computer mouse, or cutting meat. Today, I'll show you some strategies that you can try at home to improve your pain and avoid that this problem becomes chronic. So, let's talk about tennis elbow today. The lateral epicondyle is this part of the humerus bone. Here is where the muscles of the wrist attach, so they can move your wrist and fingers up like this. The tendon is this part of the muscle that attaches to the bone. When the tendon gets swollen and inflamed, there is pain, and this is called tendinitis. So, tennis elbow is a type of tendinitis of the elbow. When the pain starts, it's usually localized right above the bone. Even a tiny pressure of the bone will cause excruciating pain. And with time, this may spread to the muscles around the elbow. This one's here and this one's here. And this is myofascial pain. It's like the muscles are trying to protect the tendons, and now they start having trigger points in the muscles too. So it's one problem on the top of the other. The sooner you start the treatment, the better. However, if this home-based exercise or treatment program is not improving your symptoms, or if you notice numbness, tingling, burning, or weakness in your arm, forearm, or hand, go see your doctor because there might be something more serious like a nerve compression, bursitis, or arthritis. Here are 10 steps for you to try at home. Remember that the symptoms may persist for weeks or months before this condition gets better. Tendons take a long time to heal, and sometimes they don't heal completely until 6 months or more. Number 1, find out if there is an activity that you are doing that is causing this tendinitis. If you find what it is, try to avoid or modify that activity, using like a proper tennis technique and racket size. At work, use ergonomic tools and avoid excessive movements. Number 2, you may use a forearm band or strap when doing repetitive movements at work or playing sports. The most important thing to pay attention when you buy a forearm strap is to get one that can be adjusted easily and is soft. You need to apply it correctly on the muscle belly right below the elbow. You may use it for many hours during the day when you are doing activities, but take it off when you do the exercises. Apply heat to the muscles in the forearm before you do any exercise. I prefer a hot water bag, but you can use a heating pad, a hot towel, or a hot compress. And this is where I apply. This is because it's going to relax the muscles before you start exercising them. And you can leave this here for 5 minutes or 10 before you do any stretching or range of motion exercise. 4, apply a topical cream containing some anti-inflammatory after the application of the heat. The skin will be warm and the medication will be better absorbed by the skin. Apply a small amount just around the lateral epicondyle here. And you may do this 3 times a day. I usually like one that is an extra strength that contains diclofenac, but it has to contain some anti-inflammatory, and you can buy this over the counter. Massage the muscles. You may use your other hand to massage or a stress ball. You can use friction. Try to find the trigger points in the muscles and get rid of them. You may also move your wrist up and down while you do this massage. So you may do this here. You can also do in these muscles, but mostly will be in these muscles here that you have the pain. And if you want to massage, just go with your other hand and massage friction against the muscle fibers go in this direction here. So I recommend that you go transversal to the muscle fibers. Now do some warm-up exercises, and this can be just bend and stretch the elbows gently. Also move the shoulders up and down in circles, front and back. Move the elbows and also move your wrists up and down a couple of times, and also supination, pronation. This is just to warm up the muscles before we start stretching them, okay? So the elbows, they do basically two movements: flexion, extension, bendage, and stretch. And they also do supination and pronation. Supination, pronation. Remember when you do these exercises to relax your shoulders so you're not getting too tense. We'll do stretching exercises. With the elbow straight, it's important that the elbow is straight because the muscles, they cross this joint and they also cross the wrist. So you need to keep it straight. With the other hand, you're going to pull downwards here in front of the hand. So you pull down, 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 down. This is for the whole hand, and you can hold for 8 seconds. So 1, 2, 3, 4, 5, 6, 7, 8. And then you're going to do finger by finger. It's really important that you do the thumb. So here it is. Pull the thumb down, and 2, 3, 4, 5, 6, 7, 8. And do this for each finger. You're going to feel that these muscles are stretching. And do for each one separately. The 4 fingers here, the tendons are together. So it's more important that you really do separately for the thumb, and then the other groups of muscles, like the other 4 fingers, you can do them together. So 2, 3, 4, 5, 6, 7, 8. You don't need to cause any pain, just need to feel that it's stretching here a little bit, and that's enough. You can do this when you are sitting in the computer, or when you are taking breaks at work, or when you wake up in the morning. So if you do many times during the day, that's better. And that's the stretching exercises for the extensors of these muscles here. So then the second type of exercises is strengthening exercises. These muscles need to be strengthened. So eccentric exercises are better. I'll explain the difference. And now you can do with the elbow bandage. This muscle here, if you are strengthening the exercise, if you're doing strengthening when you're going down, this is eccentric. If you're doing exercise when you're going up, this is concentric. So eccentric is better. I'll show you how you can do this. The first strengthening exercise is what I call the praying position. You can do this when you're lying in bed, when you are sitting in a chair, or even standing up. Just relax your shoulders. And so this hand is going to put some resistance. So the left, let's say that this left side is the one that has lateral epicondylitis. So this hand will put resistance, and then I'll start putting. You see, one hand is fighting against the other one. So here I am putting resistance, and then go to the other side. So go this side and this side. So you can start doing these exercises on your breaks. And when you do this, for this side here, it's basically this hand is doing eccentric strengthening there. So start doing this. And then the second strengthening exercise, you need some sort of weights. And I recommend, for example, a bottle of water or a can of soup, or if you have weights at home, you can hold something. So this would be the other exercise. Just remember, relax your shoulder, always relax your shoulder, and you're going to go down and up and down. So 2, repeat this 8 times. 3. So when you're going down, don't just drop the bottle. When you're going down, this is the eccentric part of the exercise, and you're going to do this slowly because this is important. Your muscle is getting stronger when you do this. Okay, down, all the way down, and then all the way up. Okay, the more weight you put in the hands, the better. So you can progress. You can start with half a pound, then 1 pound, and then 2 and 3 as you can tolerate. And repeat this 8 times. And always do for the other side, because we don't want one side of your body to be stronger than the other one. So whatever you do with one hand, even if you don't have pain on the other side, always do with the other one, so they will be balanced. So after you do these exercises, I really like to apply some ice to reduce the pain. Always remember to cover your skin with some fabric, so then you avoid some burn in your skin. And just leave the ice here. So you need to put some fabric here. It can be a pillowcase or a small towel, and just put in the area that hurts more. So remember, the lateral epicondylitis is just right above the elbow crease here. That's the bone where you will have the most painful tendinitis, and you're going to leave the ice there for about 10 or 20 minutes if you can. And this is going to reduce any inflammation, any pain. I like to do this after the exercise. So before the exercise, apply heat, and after the exercise, apply ice. Or any time that the pain is excruciating, you're having a lot of inflammation there, it's really sensitive, you can apply ice, and that will reduce the inflammation. But you need to leave it for at least 20 minutes, and don't forget to protect the skin. If these home-based strategies don't work, talk to your doctor or physiotherapist. They may suggest other therapies to treat the elbow pain. This may include kinesiotaping, deep heat with ultrasound, electrotherapy, microwave therapy, shockwave therapy, injections with corticosteroids or platelet-rich plasma, and even surgery for the most resistant cases of lateral epicondylitis. Press the share button below to send this video to anyone that needs to learn about elbow pain. And in the comments below, write down if you have any elbow pain and which of these strategies work best for you. Also, in the description of this video below, when you see show more, you will find a summary of all these 10 strategies that you can do at home, and you can download and print so you remember all of them. Also, there is a link to all products that I mentioned in this video if you want to purchase them. Please don't forget that this video is for educational purposes only. If you have a condition that needs medical advice, please talk to your doctor. And if there is an emergency, go to the nearest emergency department. If you like this video, give a thumbs up here, turn on the notifications, and don't forget to subscribe to this channel. You can also find me on Twitter, Facebook, and Instagram. Thank you for watching. Goodbye!